Historical taboos once branded period blood as unclean. Today, that stigma has been replaced by digital rumors of a safe zone, the idea that menstruation offers a natural pass from medical consequences. Biologically, menstruation is a mechanical process, the shedding of the uterine lining. It is a normal bodily function that is neither a source of impurity nor a magical shield against health risks. However, the physical environment of the reproductive tract changes during this window. These shifts alter how the body responds to bacteria, viruses, and physical pressure. Ignoring these changes carries specific stakes. For instance, researchers have identified a correlation where engaging in period sex roughly doubles the risk of being diagnosed with a chronic, painful pelvic condition. The risks include a measurable drop in immune activity and a window of fertility that can overlap with the bleeding phase, contrary to popular belief. Making decisions based on cultural mix rather than cellular data can turn a standard physical encounter into a gamble with long-term health. We begin with the reproductive timeline and the common assumption that pregnancy is biologically impossible during menstruation. A standard 28-day cycle keeps bleeding and ovulation apart. But in a shorter 21-day cycle, ovulation moves to the immediate edge of the bleeding phase. Because sperm can survive inside for up to 5 days, the safe window disappears. They simply wait for early ovulation. Because the body's internal clock varies and sperm are remarkably durable, the math required for natural contraception during a period is unreliable. Beyond the timeline of pregnancy, we have to look at the body's systemic defenses. To allow the uterine lining to detach and safely exit the body, the local immune system must retreat. During this time, the number of active immune cells in the area decreases significantly. This lower defensive baseline leaves a biological opening for pathogens that the body would typically be able to repel. This microscopic view shows the result. As the white blood cell count drops, the menstrual fluid becomes a high-density medium for pathogens. Viruses like hepatitis or HIV use this fluid as a pathway to enter the bloodstream through the weakened cellular barrier. Sex during menstruation occurs when the body's local immune activity is diminished, increasing the statistical likelihood of infection during a physical encounter. The physical mechanics of the uterus also change during this time. A common focus is the release of endorphins during orgasm, which can temporarily soothe menstrual cramps. While those endorphins provide a short-term reward, researchers are investigating a more significant anatomical concern linked to the condition known as endometriosis. Endometriosis occurs when tissue similar to the uterine lining grows in the pelvic cavity outside the uterus. It is a chronic condition characterized by severe pain and potential impacts on fertility. Medical data shows a striking correlation. Those with endometriosis are twice as likely to have a history of engaging in period sex. This brings us to retrograde menstruation. The theory suggests physical pressure and contractions during sex can reverse the flow, pushing shed tissue backward through the fallopian tubes. Instead of leaving the body, this tissue anchors to pelvic organs, growing and causing chronic inflammation. The mechanical forces of intercourse may provide a pathway for this tissue displacement, potentially contributing to the development of long-term pelvic illness. These biological shifts change the safety profile of a standard physical encounter. However, the risks of infection, unplanned pregnancy, and tissue displacement can be managed with specific science-based interventions. Barrier protections, like condoms, act as the primary defense. They neutralize the risks associated with the immune drop and the shifting reproductive timeline by preventing the exchange of fluids and pathogens entirely. Managing the physical risks also requires open communication. Factors like cramp intensity and fluctuating libido are biological indicators of how the body is handling the cycle, and they should guide the decision to engage in physical activity. Safely navigating sex during menstruation requires replacing cultural assumptions with biological data and clinical protection. By understanding the unique physical state of the body during this window, you can make informed decisions that prioritize long-term health.